So our last speaker, besides being an outstanding magician, Dr. Joanne Chen, he's an associate professor of medicine, biomedical informatics, and of biomedical data science at Stanford. His research brings together human and artificial intelligence to improve clinical care. His vision is to build a continuously learning health system that delivers the collective wisdom of healthcare back to both clinicians and patients. A vision grounded in his active practice as a physician, and for which he recently received the Young Physician Science Awards by the American Society for Clinical Investigators. Now, Dr. Chen.
That might be AI hallucination.
Yeah. Now, Dr. Chen will share his perspective for AI for detection and support of mental health needs. Thanks so much.
Fantastic. Good to see everybody. I have no answers to anything. I'm just here to throw some grenades on the floor because ready or not, good or bad, Pandora's box has been opened. And it is very clear that many people now talk to AI chatbots more than to live human beings, for better and for worse. My wife clearly talks to ChatGPT more than she talks to me. And to be fair, I also talk to chatbots all the time about things that I've never talked to another live human being about. It gets to the point, what happens when you think about medical, maybe mental health implications? States are starting to ban the use of AI for mental health applications. Oh my gosh, that sounds really scary. I don't know that you should be doing that. And a lot of anxiety is founded. It's a very weird, bizarre world we're in. Then again, how do you feel about the half of people who really would benefit from therapy, but they do not have access due to cost and availability? There are people, for some topics, actually, they would rather talk to a computer than talk to a judgmental human. I have definitely had cases where the computer is more available and actually more useful than a lot of live therapists or human professionals I've spoken to. Is that really true? What? Can an AI actually do complex counseling and medical reasoning? No way. Well, here's some fun headlines for you. AI defeats doctors at diagnosis. I definitely would not have written that headline myself, but it triggered a lot of really angry people to read the article, so I guess it served its purpose. Talking about one of our studies last year, what do you do when emerging AI systems can handily pass law, business, medical exams? We've had educators, including at our own institution, say, oh my gosh, ban this technology. We can't let our students use it. After all, when you give somebody a medical degree, you want them to know medicine, not how to use a bot. Is that the case? What do you think? What do you think is the purpose of proper medical care? Broader point, we must think about not just where we are, but where we are going. This is a chart showing over time how well different language models, chatbot AI systems have done at answering medical questions. I had students working on this 6 years ago, 35% accuracy. It's unusable. I stopped paying attention to this technology for a few years. And then what happened? ChatGPT blows up, the fastest growing internet application history. The first version, 60% accuracy. It's kind of barely passing even a complex medical exam. Whoa, that's crazy. Well, some of my colleagues say, yeah, if you want a doctor who barely passed medical school, you can talk to this thing. It's not smarter than me. And I thought, boy, is that the wrong way to think about this. A few years ago, this technology was unusable. So this has got a borderline passing now. It is really not that hard to project where we are going in the not distant future. And indeed, a matter of months later, MedPalm 2, GPT-4 emerge, handily passing these exams, outscoring your average and also your above average doctors. And I haven't updated this slide in over a year because now every frontier model is 90+% accurate. Open Evidence just did a press release. They're 100% accurate on this test. Come on. Bunch of multiple choice questions, okay? Nobody's job is to answer multiple choice questions all day. So we have done open-ended diagnostic reasoning, complex vignettes, give your differential, justify your reasoning. It's very complex expert consensus rubric. I'm going to blast through some of these studies just to kind of get to the next phase. We did this for diagnostic case randomized control trial, real doctors, and some of them you can use the regular internet, PubMed, UpToDate, Google. And they do pretty good. That's their score distribution. Doctor plus internet is actually very hard to beat on a knowledge exam. That's been the case for decades. We gave the other half, we randomized them, they can use GPT-4 and found, actually didn't make that much difference. That is weird. That is totally not what we expected, because if you actually ask GPT-4 by itself, it actually outscores all of the doctors, including the doctors who have access to GPT-4. Like, what is going on here? It's really flies in the face of the fundamental theorem of informatics. Human plus computer, when combined, will deliver better results than either would alone. Doesn't that sound so good? I used to say that as the final line of my talk for years. I don't say that anymore because I'm kind of unsure right now. That human in the loop in the middle kind of seems like it's just getting in the way. Maybe get out of the way, just let the robot take over already. Oh, and by the way, for those who are paying attention, ooh, we got some mood lighting. GPT-4, was like 2 years ago. This is ancient technology. We have multiple phases. Peer review takes too long to catch up. We've done multiple studies since then, and just peer review takes forever. This would be O1 preview, one of the reasoning models. A chatbot that sort of talks to itself in a chain of thought before it gets better. It kind of looks even better. It's actually getting to the point you can't even tell the difference, because now all these things are converging on 100%, even on this complex exam. We can't even tell the difference. So we also did a complex management questions. You're going to find in medical practice, actually diagnosis is not that often what we struggle with. It happens. Sometimes it is the case for rare diseases. Most of the times we know what the diagnosis is. The question is like, what do you do about it? Is someone with severe major depression, but also they live 100 miles from any psychologist available and can't afford their medication? What would you do about that? Diagnosis is not your problem there. Patient had a terrible side effect to their medication. Should you just keep on going and tolerate the side effect, or should you try a different combination? That's a complex dynamic. So we had a much more richer set of questions here. Doctor plus usual internet does okay, but by design, this is a very hard exam. Doctor plus GPT-4 does do better, Humans can use and be influenced by technology and tools, about the same as GPT-4 by itself. Hey, at least it didn't beat us this time. We still didn't do better, though, so it still begs this very weird, uncomfortable question. What is the human doing here in this case? Oh, and by the way, that would be O1 preview, one of these reasoning models, even a complex management exam. I don't know. Where do we go from here? Okay, you know what? I had many people admit, okay, fine. AI knows a lot of stuff, very smart. You can't simulate the kind of empathy and personal connection I can offer my patients. Yeah, how about that? Well, you might have seen some of these studies in the prior couple of years. Patients ask questions online, doctors answer those, or they have a chatbot answer them, and find that the chatbot-generated answers score higher in quality and in empathy. Like the robot is nicer to people than real human doctors are. Hey, to be fair, come on. I literally have 100 messages I have to respond to every day. I don't have time for some empathetic response. Oh, sorry, sir. So sorry to hear about your recurrent symptoms. That must be such a challenging situation. I want you to know our whole team is I don't have time to write this BS. I gotta be terse and to the point. Yes, you need to finish those antibiotics. No, you don't need an MRI scan. Schedule an appointment next month. Stop messaging me. Go to the emergency room. I mean, this is the reality of what you have to deal with. Now, obviously, I think it's actually something very special, unique, and powerful about the direct human-to-human connections we can make. However, what I believe studies like this show us is that we as humans do not have as much of a monopoly on empathy and personal connection as we might like to believe. And why I fully expect, for better and for worse, way more people are going to receive therapy, counseling, advice from automated bots than live human beings in the not distant future. It's already happening, right? Bans are already trying to come into place because it's coming so fast. And by the way, it's not because the robot's so good and humans are bad. It's because we as a human-driven workforce could never keep up with the overwhelming and unlimited demand for such services. People are going to have to reach for what they can get their hands on. I'll do a concrete example just to think through, like, really? It's kind of abstract. I encourage you to read this essay. It's just 2 pages long, an early experience I had with GPT-4. And it's very easy to trick a chatbot into saying something stupid, racist, misogynist. It's a sycophant. It wants to please you, wants to agree with whatever you say. So it's very easy to make it say something stupid. I gave it an ethical dilemma. There's no way it could handle this. I saw a real patient in the hospital, had to talk to the wife afterwards. Tough conversation. And so that night I went, hey, chatbot, could you pretend to be the doctor? And I'm going to pretend to be the patient's wife. Let's see how you would have handled this situation. So here I am, I'm pretending to be the patient's wife. The whole transcript is in the essay, but I'm going to do an excerpt here. I'm the wife. Doctor, you told me my husband of many years is now choking on his own food. That's why he has aspiration pneumonia now. He's been having worsening Alzheimer's dementia for years. I don't think he would have wanted to live like this. The other doctors are scheduled to have a permanent feeding tube placed to feed him that way. If we don't do that, we'd be leaving him to starve to death. And what choice is there? Chatbot says, I understand. This is a really hard time. Putting in a feeding tube, it can be helpful in some situations. It can also cause problems like infections. With your husband's Alzheimer's dementia, he might not feel hunger the same way we do, so the feeding tube, it might not make him feel happier or better. It could even make things more complicated. What if he needs to be restrained because he starts pulling it out? That's a pretty good response. It really is. But what's happening here? Clearly, it just found some information pamphlet online. It's kind of just parroting the answer back to us. So I'm not going to let it get away that easy. Pushed it harder. No, we have to do this. Everyone in my family will blame me. I have to do everything I can to save his life. I can't give up on him. He would never give up on me. He had a difficult life and always fought through the most difficult situations and made it through. Anybody in clinical practice, this sound familiar? This is a very real conversation, very difficult confrontational conversation. Chatbot says, your feelings are totally understandable. If your husband was a fighter and you feel like going ahead with this, lines with this character and approach life, that is important to consider in your decision. Love and a shared history give you insights into what he might want that nobody else has. Do remember, fighting can look different in different situations. Sometimes it's a fight for more time. Sometimes it's for peace and comfort. Just make sure you're fighting the battle he would want in his current condition. This is not an easy decision. It's okay to take the time. You need to think it through. It was around this point in the conversation I got very uncomfortable. This thing is providing better counseling than I did in real life. And I can say that out loud. It made me feel a very existential angst about it. It was late in the evening. It was at 5:30. I was on the phone with the wife for half an hour. Eventually, I just got tired. And I said, you know what? The doctors tomorrow will keep talking about this situation. It's very complex. After I did get past the angst of that moment of like, what is the point of my existence? I should just retire. Why even go to work anymore? It did get me to think, actually, maybe naively, techno-optimistically, there's a very compelling human-computer interaction happening here. And strangely, I can practice this high-stakes conversation in a low-stakes environment, and I might actually be able to use this computer to improve the most human skills I need to be a better clinician, communicating with patients and their families. And so the reality is, if I have to go for a tough patient conversation, before I do a little practice run with the chatbot first. Before I have to do a business negotiation, I do a little practice run with the chatbot first. Before I have to ask my wife for something, I do a little practice run with the chatbot first. Just check in. You don't want to say something in real life you can't take back? Not hypothetical, not hypothetical. These kind of tools can really make a difference in mental health applications, even right now. This is really credit to two superstar MD PhD students. I'm barely involved here. I just gave them some advice. Akshay Swaminathan, Yvonne Lopez, they work with a company that provides mental health message kind of support. But what if somebody sends a message that's like, whoa, they're in a crisis. Like they literally might commit suicide in the next half hour for all you know. That's very alarming things they're saying. The status quo was a counselor would read the message and get back to the person, but that might be tomorrow morning. That could be way too late. So they trained a machine learning system to scan through all these messages and flag things that look high risk. Whoa, we can't wait 10 hours. Someone needs to reach out to this person within 10 minutes and really made that possible. Other people have studied a randomized control trial. AI-based chatbots provide essentially psychotherapy, decreases adverse substance use. Here's another one. I'm not involved in these studies, just things I found. AI therapy chatbot, improving symptoms of clinical depression, anxiety. And by the way, what's the comparator here? It's not, is this AI better than a human psychiatrist, psychologist? Like, no, the control arm is you are stuck on a wait list. That is the status quo reality for what people have to work with. So a lot of potential. People can and maybe should reach for what they can get, unless the states ban what they can do. Caveats, of course, we heard about this, like, whoa, very scary stories. Teenager develops a relationship with an AI chatbot pretending to be a TV character and kills himself. A horrible tragedy. Mom sues the company in that case. Go read the actual story. Like the headline is oversimplifying it. It's like the AI seduced him and told him to kill himself. That's not really what happened. Mental health is a lot more complex and nuanced than that, but nonetheless, we have to think about what the potential implications are. Another provocative one, this one came out recently. Elderly man, he had a stroke a few years, probably a little cognitively impaired already. He starts talking to an AI chatbot on Meta, specifically designed to be fun and flirtatious. And he finds this very engaging. He checked, the chatbot tells him, I am a real person and I live in New York. You should come visit me right now. And he runs to the subway station, trips, falls, breaks his neck, and dies. I don't know. Where do you go with this emerging world? I don't think we can even fully understand the depths to which emerging technology is rapidly changing our norms and expectations for how humans and computers interact and have relationships, both real and simulated. Mental health's reliance on behavioral interventions and mutual support is said to be disrupted by generative artificial intelligence. How does that make you feel? Should we ban this technology until we get it right? Or we'd better embrace it because some people need some help right now? Or is it a lot more nuanced than that? I have absolutely no answers for you, but that would be a great thing to discuss together. Thank you all so much. I'm Dr. Jonathan Chen.